Hi, thank you for joining us today. Today we have the pleasure of speaking to a group of first responders that are using ThirdEye's X2MR glasses and platform. And we're going to really just have a conversation discussing their experience with the glasses. So I'd like to introduce to you our panelists. We have Chief Dennis Rubin. Chief Rubin's experience spans more than 30 years. He has served as a line firefighter, company officer, commander, and chief of the department in several major U.S. cities. Chief Rubin is the author of several emergency service textbooks. His first release is entitled Rub's Rules for Survival. This book is a collection of case studies dealing with the importance topic of firefighter safety. We have Dr. William F. Jenaway, who has 50 years of fire service experience, including service as fire chief and fire marshal in East Bethlehem Township, Pennsylvania, and chief and president of the King of Persia, Pennsylvania Volunteer Fire Company. Bill was named volunteer fire chief in the year 2001 by the International Association of Fire Chiefs, and his department was the first all-volunteer fire department to receive accreditation from the Commission on Fire Accreditation International. And finally, we also have with us Matthew C. Welsh. He's been an emergency responder serving several communities since 2005. He started as a volunteer firefighter. He became an EMT and completed his paramedic training in 2009. He has been a paramedic in Upper Marion Township for the last 10 years and currently serves as captain and clinical coordinator for the Upper Marion Township Fire and EMS. He has been an advocate for clinical excellence and technology advancement in public safety. And my name is Marc Reece, and I'm representing ThirdEye. And ThirdEye, if you don't know, is a leader in augmented AR reality and mixed reality. We provide MR solutions, mixed reality solutions, and our X2MR glasses and platform are empowering first responders to provide better patient care, save more lives through wearable computing solutions. The X2 platform will relieve the pressure of COVID-19 for communities and for first responders tasked with combating COVID-19 and other pandemics on the front lines. So I'd like to thank you, gentlemen, for taking time out of your schedule to meet with us and have this conversation. Thank you so much for your heroism during COVID. And everything that you do to protect the communities that you serve. So I very much appreciate your time today. So let's get started. This question's for the panel. Prior to partnering with ThirdEye, what was your experience with augmented reality and mixed reality? And what was your reaction the first time you actually saw the capabilities of our X2 platform as it relates to first response teams?
Well, for me, it was it's mostly been limited to the commercial applications that you use for a cell phone, whether it be tracking a satellite for curiosity or something as simple as a Pokemon Go application. When I saw the capabilities of these glasses and how they can be applied, it was really a step forward in my mind for how we can perform the tasks that we need to perform, but take some of the workload off, help reduce some of those tasks, some of that task overload that people are facing.
Nice.
And I have been involved in a couple of different ways over the years. First with marketing tools and techniques that were used with my previous employer. And then we also used a virtual reality approach to try to train fire and EMS personnel to drive. And we had some challenges with that, but I think that the biggest issue was overcome when I saw the glasses and we see how we can actually use them in a day-and-date environment as opposed to the virtual reality of training someone using what I'll call historically captured content. Big difference, right. Lots of opportunity with this that you can use live scenarios as opposed to trying to create a training scenario.
Marc, from my chair, I've had a chance to work with Chief Brunacini as he has produced a program called Blue Card. It was a high fidelity virtual reality simulation where fire incident commanders get a chance to burn down many buildings. And the really cool part, Marc, is they burn the same building down over and over and over and over again. So that was a lot of fun. I learned quite a bit. When I saw the application of ThirdEye, I would be the first to tell you, I'm one of the guys that said, I'm in. I can see the application in both the emergency medical setting as well as the fire service setting.
That's great. You know, it's funny that a lot of people, when they look at it, and I think COVID has actually brought it more to the forefront, but when you're able to, we tell people that you can reduce training time or improve training, reduce training costs and time. Is that kind of some of the things that you're seeing when people are putting them on and starting to experience some of the benefits of mixed reality?
Without a doubt, we haven't been able to start field use yet. Dr. Jenaway has got us in a very structured training program where we're learning quite a bit about how the glasses are designed, how they'll function properly. And again, we've done several great days of training and testing. We think it's going to fit in our command structure very, very well. And I know Dr. Jenaway probably wants to share some of those applications that we see in the future. Bill?
Sure. Thanks, Chief. I think the applications, while we first looked at this from what I'll call the COVID standpoint, there were not only EMS-related applications, but there were fire applications and there are law enforcement applications. So when I saw the first device, I thought there's a bigger public safety approach to this than a single-use thermometer, so to speak. And we began to have some discussions talking with our personnel from law enforcement as well as EMS and fire about what can we do. So when we actually brought the ThirdEye team in to demo the devices for us and then leave us some to learn how to use, we actually looked at the basic operations of what they'll do. We tried to then understand what some next steps might be. And for instance, we set the devices up, set it up and linked back to an iPad that was set in the back of a chief's car. And one member did a 360 of a building as we would do in any normal fire situation. And at the same time, the fire officer is doing the 360, the command officer is able to visualize everything that person's seeing. So whether it's fire progression, whether it's a hazard that might be found, whether it's a body that might be found and might need EMS help, whatever the scenario was, it could be seen back at the command post at the same time. That eliminates guesswork, that eliminates the opportunity for delay in deploying resources, and creates a much more efficient deployment of those resources. And then comes the whole concept of EMS, and I'm going to let Captain Matt talk about that. But we saw much greater application in this with a variety of, for lack of a better term, tools in the toolbox that this type of a device can apply. The thermometer or just checking someone's temperature is just the tip of the iceberg on this.
In terms of, before we go to Matthew, let me ask you a question. So in terms of that expertise, where you said the expert can be behind and actually view what the firefighter or the EMT sees, and there's no guesswork, how important is that in your line of work?
Well, it becomes critical because it can be time sensitive. And a good example is, had we had these back in January when we had an apartment fire, as I did the 360 of the building, where we had people on the second and third floors literally on the balconies ready to jump. While I'm trying to communicate that on a radio, the visual explanation was so much greater. Had they been able to see that at the command post, I wouldn't have had to say, get me two guys with two ladders, one's 24, one's a 35. They would have seen that and immediately said, you, and let's get moving. That's one thing. Another scenario we had where there was for lack of a better term, a pit. And in this case, the safety officer saw it, approximated the distances. However, if you were back at the command post, you could have seen it was probably a little bit bigger than what he actually saw. So you would be able to capture in a much faster time frame what this problem is and what resources you're going to need. And then you're just going to get it done faster. That's it.
And then are you recording that?
Well, I was going to say one other thing. When it comes to EMS, being able to transmit that information to a physician who can see it is groundbreaking, absolute groundbreaking. So those are the kinds of things we saw as immediately implementable.
Nice. And the recording, then being able to learn from that scenario is also a benefit?
Absolutely.
Excellent.
That's all I can say, absolutely.
Marc, to add to that, Dennis Rubin again, before we go to Captain Welsh, it also opens up another line of communications, verbal, with the incident command post. Back to the call that Dr. Jenaway was describing, we had probably about a total of 60 units on location, taking up a tremendous amount of radio time. The radio time became very precious, and at points we would even bonk, believe it or not, that's a proper term, bonk off because of busyness in the type of system we use. What we learned in working with the ThirdEye glasses is from the safety officer's verbalization through the glasses back to the computer at the command post, it's a direct telephone link between the two. We found that to be very, very useful in all of the applications that have been described thus far. So not just the ability for our great paramedics to talk to our medical professionals at definitive care, but for the safety officer to tell something to the incident commander free and clear of going through our 800 megahertz radio system.
That's amazing. That's really awesome. That is. I think, you know, when you're getting into that level of detail, and we're only scratching the surface, I can only see better and better results come out of this, and more specific use cases that we're not even thinking about right now.
Couldn't agree more. We've talked about the application in fire investigative situations where confidentiality is critical. So instead of broadcasting it throughout the radio, without a doubt, the fire investigator speaks back to the command post. Command post now has a telephone and can talk to the police department or another investigative team, or even the district attorney, somebody in the legal profession, where the world doesn't hear the details of what this active, proper investigation is doing. I think Matt's going to add some detail about the paramedic applications.
Sounds great.
When it comes to the EMS point of view, a lot of what we're doing with these glasses allows us to ensure that we are performing what we call high-risk, low-frequency tasks properly. These are the things that we don't do every day, but are genuinely life-saving procedures, whether it be something as like a needle decompression to reinflate somebody's lung, or a surgical crike to secure an airway that's occluded. These are not things that we do every day. We practice them routinely, but you know, just like an airline pilot having a checklist, being able to go down that list and make sure that you hit every one of those critical life-saving steps, having that resource available without tying up your hands or anything like that, makes it a definitive advantage. Additionally, when it comes to assessing patients with unique medical conditions, being able to have both that voice and data link back to our medical command centers gives us a degree of interaction with the physicians that wasn't possible before. So we can do a much more comprehensive stroke assessment to ensure that that stroke patient gets to the right facility, or a patient with a very special rare medical condition, making sure that their needs are met. This allows us to accomplish that in a way and at a bandwidth we were not able to before.
You know, it's funny when you talk about workflows, I think a lot of people take the simplest tasks as, I don't need anything to remind me. And I relate it to when I used to own a bakery, and we had something called mise en place, which means you just follow these steps. And I was around Christmas time, I forgot to add salt, which was the main ingredient in bread. And I didn't figure it out until afterwards, because I knew the recipe. But imagine doing that on somebody's life and missing one of those steps. You're talking very critical. So that's great to see that, you know, what we've been talking about and what we've been writing about is actually being put to use, especially in the workflow environment with critical care tasks. Chief Rubin, the next question goes to you. And I started the introduction and I mentioned that you're an accomplished author. In your book, Rube's Rules for Survival, you discuss firefighter safety, which I see as probably one of the most important aspects of the job. What role does technology play? I know we discussed it a little bit, but what role does the technology play? More specifically, how can you see augmented reality or mixed reality technology like the ThirdEye glasses and platform aiding in safety on the job and in training?
Wow, what a great question, first of all. And let me give just a bit of background. In the United States, in a typical year, 100 firefighters, EMTs, and paramedics will perish in the line of duty. Somewhere between 80 to 100,000 firefighters, EMTs, and paramedics will be injured in the line of duty. So to have the ability to add another prevention tool in our arsenal is critical. Before I get to ThirdEye, I'm going to go back to some of the technology breakthroughs that I have experienced during my career. If you would have told me as a brand new recruit firefighter a while ago that a firefighter could literally see through smoke by using a thermal imager camera or determine the ceiling or floor temperature with the same device, that would have been unheard of, and we just simply wouldn't have been able to fathom that. The next major breakthrough, or along the way another major breakthrough, has been that with the breathing apparatus and how we protect our respiratory system. And of course, when we look at the turnout gear, from what would be called a very simple duck canvas coat made of mostly cotton material to the exotic fibers today, tremendous. The point of the background is to say it's limitless. The ability to use the ThirdEye to provide feedback to command, amazing. The ability to use ThirdEye to be prepared for situations that might involve violence might be another example where firefighters get killed and injured. Again, another great application. The ability to use it in hazardous materials responses. Dr. Jenaway alluded to that with the size of a pit that had material that we were concerned about. If we had the glasses, the incident commander can make a much better, clearer decision back at a command post where there's lights, there's markers, there's staff, there's help, versus a person inside of a face piece or an encapsulated suit. So by having those available on the responder inside of their turnout gear, protected as well as the member, the opportunities really boggle the imagination to start cutting into that 100 firefighter fatalities a year. I think this tool will have an impact. I really do. I believe that some of the things that we have discussed already to be able to determine the amount of crew that's needed to raise a certain number of ladders. Again, we have always flown in a way that was a good best guess, and it was a great guess, quite frankly, but now we can refine that guess to a little bit more of a scientific known entity by seeing firsthand. And another application that we have discussed in Upper Marion is to have folks remotely to the command post. So in other words, sometimes Dr. Jenaway finds himself enjoying the great sunshine in the state of New Jersey. I think I said New Jersey correctly. So as he's down enjoying his tremendous home in Cape May, and we need some legitimate, honest advice about how he handled a certain situation previously, or can he give us his best advice how to handle this one? That's a matter of Bill flicking on a computer, dialing into the access code, and being able to watch firsthand from essentially 100 miles away what we're doing and give us some coaching and prompts and tips.
I think that we call that either remote mentor or knowledge transfer, but I think it's extremely important, specifically when you have recruits, and you guys have tribal knowledge. But I'm going to assume specifically with all the riots that have been going on lately that there's a lot of newer recruits that are getting called to these scenes that don't have that experience. Would these glasses work in an environment like that?
I would say, again, without a doubt, to try to begin measuring what the potential protesters in terms of numbers might look like to build an appropriate response force. Remember, our response force is to put out fires and other things, so by no means am I attempting to imitate what a police officer might do, but do we need one engine company or 10? And again, we can begin doing those estimates. We get a lot of information back about potential fires being set. Well, again, we can see if a fire has been ignited as an example. So I would say the application in any kind of a civil unrest case with the ThirdEye is right up there again with the imagination. If you can see it and see it back at a remote command post where you can have really capable, qualified people making the best decisions for your community. I don't think you can beat that, Mark. I really think that's a rock star position to be in. Rock star is something I like.
Mark, also keep in mind that if it's me in that frontline position at a riot situation, all I'm going to see is what is in the peripheral view of my eyesight.
Right.
If I am transmitting that back, even 2 blocks or 3 blocks away to a command post, to Chief's point, there could be 8 different people looking at this from 8 different viewpoints. So one's trying to evaluate what kind of things these people might be using to do their bad deeds. Another person might be looking for other aspects of their actions and so on. From a fire standpoint, it's the same thing. We can take a look at a building that's on fire, and we may see smoke discolorations or smoke changes in colors that the incident commander may not be able to see from an operations standpoint up near the building. So, or we could see a building start to collapse before the person who actually has the glasses on is seeing it. So having multiple eyes look at it at the same time becomes a critically valuable point. And I wanted to make another point too. What we really have here is what I call military technology transfer. And we haven't had this in the fire service for a long time. Now, we got it back in the late 80s with the thermal imaging camera. We got it in the 90s with robotic type equipment. But we haven't seen it for a while out of the military. And this is a great application to take what the military has learned and how they learned how to use this on board ships out in the battlefield to get information back to docs. This is a great tool for us because, frankly, we are a battlefield. It's just a little different nature. We don't always have guns being shot at us or bombs, but that fire is a pretty hostile environment. Okay, that sick patient, that COVID patient is a hostile environment. And this gives us another set of devices that give us that extra technology advantage that we never had before.
That really is great. And I think that the fact that you're embracing technology, I think a lot of government agencies, municipalities, they're slow to adopt. And the fact that you were so eager to adopt excites me, which is really one of the reasons why I wanted to have this conversation, because I think a lot of people need to hear what you're saying. So I'm listening to your stories, and I'm just in awe of what you guys do. I've always had the utmost respect for firefighters and police officers, but literally getting to hear what you guys do and go through is eye-opening.
We haven't figured out a way for it to play checkers better yet.
Well, there's a program for that. There's going to be an app for that. Matthew, I have a question for you.
Sure.
As an emergency first responder, you have to be prepared to work in a variety of emergency, and we kind of touched based on the civil unrest situations as we have going on now, like the violent riots that are happening all across the country this week, this week and ongoing. In your opinion, and I'm kind of bringing that question twofold, you're working on a patient, right? You've been called in for an emergency. So not only do you have to focus on the patient, but now you have to have your back too. And I mean, you have complete anarchy and chaos. How do you deal with that? And do you think that the augmented reality would benefit a situation or a scenario like that?
So one of the things I'm very aware of is task saturation. All of our members have the ability to get task overloaded in an environment. You're taking care of somebody who's absolutely critical. You're trying to manage their condition. You're trying to look after your safety. You're trying to look after your partner's safety. You're trying to stay on top of the safety of other responders. And anything that we can do, anything we can provide to help reduce that task saturation, help prevent task overload, is a huge priority for me. So by making sure we have those checklists available, making sure that we have that remote assessment capabilities, that you're focused on your patient, you're doing what you need to do, and you're worried about whatever going on around you.
Yeah.
If we have somebody there that can say in your ear, say, hey, consider X, Y, Z, or you might want to do this or that, that helps take some of that mental loading off of the provider doing all of those tasks all at the same time, and it improves safety.
I think that's really the underlying message, is that we're trying to improve safety, not only for you, but for the patients, provide a better patient experience. the amount of stress that you guys have to go through, I don't even understand how you guys focus. But the fact that you do it so well, and when I've gotten a chance to watch you guys, it's just like it's second nature to you all. It's really impressive.
Well, thank you. We work very, very hard to maintain those levels of skills. I consider myself very, very fortunate to work with some of the best around, and it forces everybody to step up their game when everybody around is at the top of theirs.
So let's kind of pivot a little bit and talk about training for a pandemic like COVID. So when we first started learning about it, there was a lot of mixed messages where you got to wear a mask, don't wear a mask, don't worry about it, worry about it. And there was a lot, and I think we're still getting that. Nobody really has a definitive answer on what we're supposed to do. So in terms of learning how to treat COVID, what's some of the things that you've kind of learned over the course of the last few months that you didn't know? And can technology and AR benefit a situation that you're called in with a pandemic like COVID or a disease like COVID?
So one of the things that I've noticed, the frequency of the changes of the guidelines seems to be increasing every week. Something new is coming up, something is changing, a recommendation is changing, a procedure or protocol. It's constantly evolving. So having the latest data, the latest recommendations available to you right then and there is invaluable. What may have been recommended a month ago could be contraindicated today. So just having that information available right then and there as you're interacting with these patients who are potentially very, very sick, could potentially get us very, very sick. Like I said, taking some of that workload off to make sure that you have access to those most current, most accurate information is quite the benefit for safety and providing care.
So what I know about COVID, and by all means, please tell me if I'm wrong, I'm under the impression that you could have COVID, but if it hasn't manifested itself, you're not going to detect it via a thermal imaging camera, or you'll have no way of knowing that you have it. So there's that incubation period. Is that correct?
There's a substantial number of patients who have it that don't know it and will never know it. They're the asymptomatic patients.
And how do you have to treat every patient like they have COVID? Like, when you're on a call, you try to take a temperature? How do you kind of evaluate?
So we take temperatures on almost every patient that we encounter. 99.995% of the patients we encounter get their temperature taken. We have all of our screening questions built in to our assessments. Our county 911 center asks screening questions as well. For every patient contact that we make, we wear N95 at a minimum masks to keep ourselves safe. If there's any indication that there might be something potentially COVID related, we wear full isolation equipment, and that's all to keep ourselves and the patients safe and prevent the spread of this disease.
And in the thermal imaging camera, if you've used it, are you able to you can definitely say, hey, this guy might actually have it? I mean, are you able to see the spikes?
So at this point, we haven't had the sensor rolled out that's precise enough for medical use yet. We're looking forward to that down the road. But at this point, we treat everybody as if they potentially have it, and that's our safety net.
Excellent. The next question is for Chief Rubin. Chief, what effect do you expect AR and MR to what effect do you expect AR and MR to be adopted within your fire department? I mean, and across fire departments. I think one of the challenges is we think about use cases and we think about scenarios. And if you were speaking, which we're going to be broadcasting this, if you were speaking to other firefighters and other fire departments and other chiefs, what would you tell them is the use case, or what do they need to look for? Because I think there's a disconnect with people think they need to have a use case, or they might not have a use case. What's that specific thing that you want to start the conversation with and tell people why they kind of need this, why they need to incorporate this type of technology?
I think the application that Chief Jenaway opened up with is the really low-hanging, delicious fruit. We're going to jump all over that. We're days away from implementing a system where our structured on-duty incident commander will have eyes 360 degrees. If you were to go back a ways in terms of what the fire service did and how we operated, 360 was kind of unheard of. If a person is attacking the fire from the front and we heard that there was fire coming out of a back window or a person getting ready to jump, we'd sort of stop there and run around back. Well, we graduated. And what graduation meant is we have a dedicated safety officer. That safety officer, among all of their responsibilities, to look for unsafe acts, unsafe behaviors, and unsafe conditions, is they've got to do a constant 360 around the building. They've got to be looking up and down, right and left, trying to find out things where the gas shutoff is. Is there fire extending? What's the building construction changes from front to back? One that seems to trip up firefighters often, does this building have a basement or not? Well, what we've done with that information, again, over the past couple of decades, is to move that information by radio. And you got to admit, all people are not created equal. Some safety officers would knock it out of the park. Others might be a little bit more timid or perhaps not as well trained. Now, back at the command post, I'm going to change that snapshot for you, Mark. We've got an incident commander, well-experienced, highly capable. We've got typically in our system a deputy incident commander, another co-equal chief, equal training, education, and experience, and most likely we have what we call an accountability officer. Most cases, 3 heads are better than 1. So as that 360 degrees is being taken over and over again during the course of this event, voila, now we can begin making some very critical, important decisions to be able to provide for safety and survival of our firefighters and to do a better job for our citizens. I don't know why, but we've been a magnet lately for bus crashes. Some of the bus crashes have occurred in the most unlikely places. One that happened on the Schuylkill Expressway, I hope I got the right highway, I think I do, was down a very deep ravine getting ready to go to Henderson Road. Well, then, if the incident commander is in the middle of that mix, nobody's in command. That's a statement of fact. The incident commander has got to be remote, has got to have radio equipment, has got to be able to think clearly, develop strategy, tactics, oversee tasks and resources. And the only way that that can happen is, again, back at the command post. So the glasses, if we would have had them, start sending back how many patients, are they trapped, what type of bus, is the bus leaking fuel, is the bus getting ready to catch on fire, and all of those points of information, which we would call critical factors, are being beamed back to the command post. If the safety officer is not available, and we can put those glasses on a brand new boot recruit, bottom line is we can still get that information back. It still makes a great impact. And I always wonder about the difference between training and education. Are you familiar with that? When we talk about education, Mark, it's in a classroom setting.
Yep.
Then when we talk about training, it's usually hands-on, carrying a fire hose or extinguishing a fire. And then I think about my daughters, that I want them to go to high school and have sex education or sex training. I rest my case.
You know, but that's important because what this
does
does
is funny,
is
Mark. You didn't laugh. You did not laugh.
I'll edit in that laugh. I'll edit in that laugh. No, you're right though. I'm glad you brought that up because well, that's a whole new use case I didn't even think about. We're going to be writing a use case guide after that.
Come on, that was just a joke. It was a cheap joke to get you to laugh, and hopefully the folks listening in. But on a serious note, the potential of ThirdEye is just amazing. It's limitless. It probably equals a person's imagination.
We've actually seen with different studies that there's some huge reductions. Specifically, you have the classroom training, but then when you can extend that classroom to the field, and as you called it, a new boot, get him out there in the field, get him working, get him hands-on, you've reduced that onboarding time, you've reduced that training time, you've essentially made them more effective and given them a better ROI because the amount of time it takes to train from fire school to the field. But
I think you're right on track, but I'm going to pitch it to Dr. Jenaway because I think where we'll get again another great opportunity is in our command level training first. Doc, you probably want to opine on that.
Yeah, I will. There were a couple of things that I wanted to mention. So let's imagine that we are at a fire scene and the first arriving officer pulls up and he sees what appears to be some gray colored smoke coming from a building. If he does a 360, well, let's put it there, he doesn't do a 360. He does what traditional firefighters do. First engine gets there, he takes the line off, he goes in the front of the building, and he hopes that he's going to find where the fire is because he's got a general idea from where the smoke is coming from. Now, put on your third eye and do your 360 and have that image coming back to the command post. Now the safety officer, whoever has them on, goes to the rear of the building and he sees you actually have an L-shaped building, not a square building. At that L shape in the corner, there's a door. The door takes you into an area that you don't have access to the main building. But the fire's in the main building. You've now eliminated 50% of your exposure problem or potential because you now zeroed in already where that fire is. So your efficiency now comes into play. So let's fast forward. Now we have an incident in this fire because we didn't have our full 360 or we didn't get a better understanding of smoke color and smoke change. And now we have an accident and we have a firefighter down. The medics don't know what happened. They don't know whether this is an injury where he simply fell, whether he was knocked down, whether he was overcome by smoke, or whatever the case might be. But if the safety officer or whoever is doing their 360, there's a high probability that they caught where the firefighter was when the accident occurs, what was happening when that accident occurred, and allows them to go through their medical protocols much quicker to determine what they have to do to treat this patient. That's a real life scenario that 20 years ago would not have been done that way, would not even been considered, and we could have had a seriously injured firefighter versus today where we know the mechanism of injury, we know the nature of the problem that we're going to have to deal with, and he's getting treated a whole lot faster. So there is a multitude of opportunity with this product that we haven't even scratched the surface on. And let's go back to the training because I wanted to make this point.
Yeah.
Again, I mentioned earlier, one of the things that I did was look at virtual reality for driving emergency vehicles. We learned very quickly that the programs were driven by scenarios. To change those scenarios became extremely costly. If you can wear glasses that change that roadway every time you put them on, or that reenact that same roadway where an accident occurred time and time again, you're not going to make that same mistake twice. And everybody who follows you is not going to make that same mistake for two reasons. Number one, it's going to be live. It's not going to be a piece of software driving you. But more importantly, you're going to actually experience that. If you are sitting there behind the wheel and you're just looking at this scenario, it's going to be totally different than if you're sitting behind a game board. You're in a fire truck. You're actually looking at the area that you're involved with. It's totally different now than if you've got that high speed and I'm going to take this turn. Oh, well, I'm going too fast. I'm going to crash this thing. It's different when you're in a real vehicle. And I think the same thing will be experienced here. As we move toward using this on actual patients, as we move toward using it in actual fire scenes, we're going to learn more about actually applying the types of techniques that we use to solve problems. And we're going to learn what works faster, better. And it's going to eliminate a lot of that trial and error that you do when you're doing traditional virtual reality.
That kind of brings me up to it's actually kind of a nice transition to my next point as we're doing the training. One of the things I want to talk about are standard operating procedures. And I'm going to throw this out to the panel because I'm interested to hear each one of your takes. But from what I understand is that you guys have protocols and procedures that you absolutely must follow. We've kind of touched base on a few of those. But in terms of augmented reality or virtual reality or extended reality or whatever reality you want to talk about, mixed reality, Have you thought about protocols to incorporate this? Because I think that there's a lot of people who, oh, we'll just incorporate this. What are some of the things that, what are some of the, what could you tell somebody that's thinking about doing this to think about in terms of protocol and standard operating procedures as it relates to the augmented and mixed reality?
Captain Matt is up on this one.
So I want to circle back to those high risk, low frequency protocols that we utilize.
Yeah.
By using an augmented reality environment and the MR the MR glasses in the X2 platform gives us a great tool for doing that. What we can do is in training scenarios, we can overlay the right way to do things, proper procedures, proper protocols, right in that field of view to develop those good habits. On the EMS side, we've got something like 300 different individual protocols that we operate under on any given day. So having that data readily available and easily usable and in a format that the provider can interact with without compromising those patient interactions, that's solid gold to us. So we've actually been working with the ThirdEye team to develop a protocol application where it's searchable by number, by medication, by protocol name, to bring up those protocols in a form that we can actively apply while providing patient care. So we have so much data available to us, whether it be pre-plans or these protocols or quick reference guides, but that's a lot of different sources to get. By combining all that information, by combining those pre-plans into the MR platform, by combining those protocols into a searchable, usable guideline, we can really help streamline the process. Well, one of the other things that we can do is within those protocols, we have certain stop points where we need to validate our orders with medical command. Before, you shall not pass until you've spoken to the command authority. And by streamlining that process, by having the glasses of that doctor right there, we look at this patient and can go, command physician, we're at this step. We want to do X, Y, Z, which is below the command line. Instead of taking the time to verbally communicate all of that information, all of those pertinent details to the command physician, pictures worth 1,000 words. One quick glance at that patient, they can tell very easily, is that the appropriate step or do we need to go down a different pathway? And that really helps us streamline a lot of things.
Now, I'm all about data when it comes to marketing, and I'm trying to figure out taking data and then measuring our marketing effectiveness. And so I'm going to throw that question to you, not in terms of marketing effectiveness, but overall effectiveness, and what kind of benchmarks are you looking at to judge the outcomes? So how can you determine if something was successful, if success or failure, and what would you tell somebody that they need to start thinking about in terms of those outcomes and measurement?
So I am also a huge data nerd, and our charting software, which we are looking to integrate into the MR platform, allows us to track individual procedures by provider, by time of day. I can tell you what your IV success rate is when your call is between 2 and 3 o'clock in the morning. So what we do is we monitor all of those things routinely. I spend a inordinate amount of time with my face in a computer screen, making sure everybody is meeting their benchmarks. So if we notice any substantial deviation, we consider it a problem. And once we are able to roll out these glasses into actual field use, I'm hoping to see those numbers trending up in success rates, in appropriate applications, and appropriate use of different techniques.
That's great, and I think that's how we improve, right? That's how we judge the effectiveness. Does anybody else on the panel have anything to bring to throw in on that part?
Not good.
So Dr. Jenaway, this next question is for you. A few years ago, I spoke with Captain Kirk, one of the people responsible for getting funding for the FirstNet Authority through Congress after 9/11. And as you know, FirstNet operates on a nationwide broadband network that equips first responders to save lives and protect U.S. communities. One of the things we spoke about were the challenges that he faced getting this implemented. And, it's great that you were able to get this implemented, but a lot of municipalities might hit roadblocks. And so is there anything that you can talk about? Because Captain Kirk said it took years to get FirstNet Authority implemented. What challenges maybe you did or didn't face, but how can you help or give some advice to somebody who wants to implement technology and overcome the challenges that they may face?
Well, the first thing is don't let somebody throw a roadblock in front of you, just to throw a roadblock in front of you. We knew that there were going to be some issues, particularly in the Commonwealth of Pennsylvania, to get this type of communication approved at the state level. And then it was going to have to get approved by the hospitals. So we know that that's part of the issue here. So knowing where your obstacles are and then not letting people tell you this is an obstacle, so let's not do it. There are a lot of people in our roles, and I don't mean to demean anyone, but there are a lot of people in our roles who don't like to do work. This is work to get this done.
Right.
And it's work politically, it's work technically, and it's work operationally. So understanding that going in, that you're going to have to get approvals. Another, for instance, we know from our law enforcement opportunity with this, we know that there are things in the Pennsylvania wiretap law that we have to get approval to use this device. Our chief of police, who serves as our public safety director, was on that immediately and started looking at how do we get the same approvals for this that we get for our body cams. It's that simple, but it takes initiative, it takes someone to do it, and it takes someone to follow up with it, which is leadership. So someone has to take the ball to see this and move it forward. There are some elected officials who probably don't want to do it for a couple of reasons. Number one, it's work. Number two, this really isn't fancy stuff that a lot of people are going to get excited about in many ways, the general public, I mean. So is this going to do me any good as an elected official? Maybe, maybe not. But from a practical application in public safety, this is a great tool. And if people look at it like that, it will immediately enable someone who's a leader to pick up the ball and move it forward. The other thing is that while there's a cost involved with the product, the cost per se is insignificant to the cost of other types of technology and equipment that one might have to buy. And there are many organizations that would love to buy something like this for a public safety agency. I probably get an inquiry, at least one inquiry a month in our community from somebody that wants to do something for public safety, whether it's get another police dog or help us with something at the fire department or something with EMS. But there's always somebody that wants to do something or some group that wants to do something. This is a perfect little fundraiser activity. Kids groups are always looking for ways to get involved. And I think that if you take this device and you show it, once it gets matured, and you show it to the youth of today and how medical students and individuals in high school who want to get into a medical career, how they can learn with it, become EMTs, become paramedics, go to med school, be a nurse, whatever the case might be. There's a great opportunity here, but you have to have vision and you have to have leadership to make it work. Oh yeah, and I mentioned you have to want to work at it to make it work.
Yeah. I think though that you hit the nail on the head, because when I was talking to Captain Kirk, I'll never forget, he said Congress was all for this when they heard about FirstNet. And then when the cameras were off, it was like, oh, I don't know if I wanted, it was back and forth, and they were finally able to get it implemented 11 years later. When we try to tell organizations, specifically public safety, that this can help save lives, we're not kidding. We're not saying that it can help save lives as a sales pitch. We're saying this can help save lives. This can help reduce costs. This can actually help improve the efficiency of your public safety officials.
Absolutely. Look at the thermal imaging camera. Go back to the late 80s. The military had a thermal imaging camera. It could detect body heat. Now we don't use it just for detecting body heat, but we use it on every fire. Every time we go into a building, there's a thermal imaging camera with some firefighter evaluating the extent of the exposure of heat before we do any activities. It's game changer. And this is going to be the same thing. We're identifying issues before we make entry into that hostile environment.
Speaking of that, when you're using a thermal imaging camera, you're in a building burning, and you have maybe the mask on, or you have the thermal imaging camera. Are you really able to see through smoke and fire and into the next room?
Well, you can't see through walls necessarily, but you are able to visualize whatever that camera is going to show you. So if it's going to show you heat patterns, you're going to see that heat pattern. If you don't always see visually through it in a thermal imaging camera, but you see some image, whether it's flames, whether it's a body, something of that nature. But again, depending on the glasses or the camera, it could be very, very minor, or it could be expanded.
That's interesting. I want to go back to Matthew for a second, actually for the panel. One of the things that we're working on is our glasses are HIPAA compliant, our platform is HIPAA compliant. And one of the things that we're going to introduce in the future is being able to update patient records in real time. So connecting to the database and being able to see a patient's records and then update it. When you're on a call, how important is that to have that data to be able to see what their medical records, but also be able to update them in real time?
So for us, information is life. The more information that we have, the better decisions we can make. Certain medications have contraindications with other medications. Certain medical conditions cause contraindications with certain life-saving procedures. And the more information that we have access to, the better care we can provide. So the ability to tie into a patient's EHR, electronic healthcare record, from the field is a huge step forward. Due to certain regulatory constraints, we're quite a ways away from doing that. Currently, we are limited in our access to patients we have encountered within our organization before, but that is a bridge we are looking to cross. All of hospitals these days can pull their records from other hospitals, and the way the healthcare laws are written, we should be able to get in on that. But that's a lot of information moving over a very new method of data transfer for these established hospitals, and it's taken some work and taken some buy-in, and we're definitely working on getting our advocates on the hospital side to get us access to that information. But that information can literally be the difference between life and death for a patient.
That's, yeah, I think so. And when you transport that patient to the hospital, you have to give I'm assuming that you have to give a complete path. Are they already aware of what's going on through the radio transmission? So
to the hospital, for your routine patients, it tends to be a very short transmission as to what's coming in. A 35-year-old female with leg pain. For a complicated or very sick individual, that can be a lot more information moving across. And unfortunately, sometimes the words just don't do it justice. The images can really tip the scales between, does this patient go to triage, or do they get a full trauma alert and are in CAT scan 30 seconds after we walk in the door? So sometimes those visual cues can help relay information that we might not necessarily relay as accurately verbally.
And finally, and this is for each of the members, is there anything that you would like to talk about that we didn't cover, or is there anything that you would like to say that you feel needs to be said?
Mark, I just want to hitchhike on some of the comments that our captain made. They were great comments. We're very carefully watching our turnaround times at the hospital. Drop times for us, the goal is 30 minutes or less. And if we can do that, we'll have more ambulance capability on the road in Upper Marion Township and a lot less downtime. So as Captain Matt described, by the doctors or nurses or physician's assistants or other technicians can identify which bay, which area, which section of the hospital, operating room perhaps, that the patient goes to, cutting into that time loss that we experience. It's simply going to save lives and save money by having more ambulance time available in Upper Marion. We do about 4,500 calls per year with 2 ambulances. So it's getting to the point to where we need that capacity. And again, I think ThirdEye is going to allow us to be a little bit more efficient, a little bit more effective in saving lives, and quite frankly, saving dollars. I think Matt's got a couple more comments to add.
Sure.
And a doctor's going to close us out.
Sure.
We have access to so much information, and using the MR platform as a way to organize it and make it readily available is going to be a true game changer. This is this is a very young product in the public safety field for us.
Yeah.
We're still figuring out how best to use it. We're still developing those use cases. It's growing. Every time we put one through a training scenario, something else comes up, some new application. The more people's hands that we put these in, the more ideas we get. So it's rapidly growing. It's rapidly developing. We've got a lot of excitement around it, and we're really looking forward to building this out and making it a truly valuable game-changing tool.
That's awesome.
And I guess I would close this out by saying, if I look at the approach from a municipality, we have so much money to do so much with, from staff and from resources, with the ultimate goal to save lives. This becomes an efficiency tool for us. And the more that we can implement efficiency tools, then the better off the people are going to be served. So while it's a life-saving tool and it's a great tool on the fire ground, this is a productivity tool as well from my viewpoint. And when you start to package those all together, you end up with a leading-edge product that is going to enhance the public safety of the community. And I'm going to do this as the elected official hat right now. The number one role of a politician or an elected official is to make sure that you're safe when you come to that community. So public safety is your number one job. Nobody's going to come to that community if they don't feel safe when they come to that community, whether it's from crime,
Amen.
they get sick, or if there's a fire, or if they ride on a road with a lot of potholes either. So, and as long as the sewers work properly. So there are a few things that work into public safety, but my point is, this is a public safety tool, service, performance capability that's next gen. And I think that's how we have to look at it. That's how we have to develop it and integrate it into our daily routine.
Gentlemen, I very much, first of all, again, thank you for your service. I've learned a lot, and I know that everybody that watches this is going to learn a lot. And, you know, one of the things I want to say, especially to Chief Rubin, if we could just turn to Chief for a minute. I started, when I was doing research, I started going through your book, the rules for survival, and your stories are fascinating, and I'm going to dig deeper. Do you want to let people, let's give a shout out. Do you want to let people know how they can purchase that book?
Sure. The book is available in several mediums. You can get it from fire engineering, which most firefighters are going to know, as well as it's carried on Amazon. And if folks want to contact me directly, I'm always willing to get them shipped out. Not that I wanted to do a plug, but since you mentioned it, there's several other books on leadership, as well as command and other case studies. So it's been a lot of fun. And again, just watching the technology continue to move at a gallop, it's been very, very impressive. This is going to be the next step. I think both Captain Matt as well as Chief Jenaway has been very clear. We are truly excited about this product.
Excellent. And if you send me the links, I'll put that in the post that I'm going to post on this video so people can access. And then if you want, I can also put your contact information in case anybody has questions for you. Gentlemen, thank you so much again for your time. I appreciate it. Thank God you guys are all safe. And this has been an ultimate pleasure. I really feel honored that I got the chance to speak to you all.
And we're glad there was no direct code today.
Thanks, guys.